Talk podcast. My name is Erica and this is Brandy.
Hey, everybody.
So, if you guys are joining us for the first time, our podcast is focused on providing the underserved and underprivileged communities, particularly of people of color or communities of color, with the
Yeah.
information and tools to improve their dental health care experience.
Yes, ma'am.
Yes, yes, yes. So, tonight's episode is all going to be about implant supported dentures. Exciting.
Yes.
Yay, yay. Okay. So we're gonna do. I got a couple questions for Brandy, right? I'm
Yeah.
pretty sure these are the same questions that the audience, you guys, would have as well. So we're gonna start off with Brandy. What are implant supported dentures?
Okay, so you guys know we've been on this restorative healthcare series, and we've been talking about dentures for a little minute. So this is going to end that portion of the series. So just like all the other dentures, the implant supported dentures are going to serve to replace teeth. So if you're missing most of your teeth or all of your teeth, this is another way that you can replace those teeth. But the difference is these dentures are supported and kind of snapped or locked into place on top of implants. So they're the most secure of all the dentures that we spoke about. So the partials, the immediate or temporary, and the permanent full upper and lower. So these ones are the most stable. A lot of the folks that get this, they either have teeth that are missing or need teeth removed, as we talked about before. So once those
Mhm.
teeth are removed, in order to support implants, sometimes you have to have bone grafting done when you have the teeth removed. So we will talk about that. But this is for anybody who's missing teeth already or needs all of their teeth removed, just like with the other dentures.
So, Brandy, do implant supported dentures come out?
So you can have implant supported dentures that snap in and snap out, or you can have an option that are not removable. And that option, they will not snap into, but will kind of screw into the implant and be fixed. And you won't be able to take them out if you have them. But if there's an issue of some sort, your dentist will be able to remove the denture into if they needed to. So this is probably the more stable, and it just depends on what you're looking for. It's going to be harder to clean, but it can still be cleaned as opposed to taking them in and out. And they only, if you do choose the option where they snap in and snap out, they only come in and come out when you take them out. So they're not going to fall out on their own or anything like that.
So, do people have like a whole mouthful of these?
So, all right. So you mean the implant itself? Like how
Yeah.
many implants is it?
Hmm. Yeah.
It depends on the patient and the amount of jawbone they have. It depends on the surgeon or the periodontist who's doing the procedure. But sometimes they can be supported by just 4 implants, sometimes
Hmm.
5, sometimes 2, sometimes 3, just depending on the size of the patient's arch, the density of the bone, and like other different things of what's going on. Sometimes up top, the sinus may be in the area, so they might not put ones further back. They might put them further forward. So it just depends on the patient. But I wouldn't say there's one replacing each tooth, if that's what you mean by a
Okay.
mouth.
That's what I mean.
So no, that's not going to happen.
Okay.
Yeah.
And how are implanted supported dentures placed?
Cells, they are placed into the bone. So just like we talked about in the implant episode where I explained, you can refer back to that episode to get
Hmm.
more details. But basically, they are screwed into the bone, for lack of a better way of saying it. And it takes time for that implant to fuse with the jawbone, but you have to wait a specific amount of time. But that's what happens. So we have to place the implants singly, and then they'll be covered. They won't be sticking out while you're healing because you're not going to be able to chew or use them like teeth until they be fused to the bone and become really solid. So you'll have a healing denture while you're waiting for those implants to fuse, which can take anywhere from 3 to 6 months.
Okay.
And it may take longer if you have to have any bone grafting done. Before you have them placed, like before you actually have the surgery, you're going to have, of course, any teeth that are decayed or damaged removed, right, Erica? And then they will perform
Yeah.
the bone grafting at a time. So some people need bone grafting when they have teeth removed because the bone is not dense enough. And sometimes when you remove teeth, portion of the bone go with it because of course the teeth roots are fused to the bone.
Mm,
So
yeah.
everything gets
Like a
smoothed
tree root.
out. Correct. So everything just similar to that, Erica. Everything will get, once it's removed, everything will be smoothed out, and then they will fill the space with bone grafting material. Now it depends on what material they use. Sometimes it's actual bone, and if that is placed, it's going to take longer for you to heal before you can get the implant placed, if that makes any sense. So you
Hmm.
have to make sure the bone is solid before the implant can be placed in the bone. So once the tooth is removed, if you have bone grafting, you have to wait for that bone grafting to heal. That can take 3 to 6 months, depending on what area of your mouth it's in. If it's a front tooth, it's going to be a short amount of time. If it's a molar, it's going to take longer because those are the teeth you chew and bite with,
Okay.
and grind your food. So that's the purpose of the bone grafting, is to fill in the bone so that it's nice and solid place for the implants to reside. Okay, and so once the implants are placed, like I said, it'll take about 3 to 6 months before the implants fuse to the jawbone. You'll be wearing a healing denture in the meantime. So that denture is just an interim denture. It'll allow the tissues and the implants to heal without you actually biting on them. So you'll keep that denture in, and then once you've reached your healing, which, like I said, is about 6 months out, you'll have impressions done, and those impressions will be used to send to the lab so they can make the permanent implant denture. Okay, and then once
Hmm.
it's all made, the denture will be placed, and then you'll be taught how to like take care of it. Okay, so how long do implants and water dentures last? Okay, so they last, the implants themselves, if they're taken care of properly, can last a lifetime. And then the denture, the part that snaps onto the implant, can last about 15 to 20 years with proper
That's
care.
good because that's longer than what breast implants last. I think they only last
Yeah,
like 10 years,
yeah, I think they're like 10 to 15 or something
10 to
like that. But
15
yeah,
years.
so
This is
right. I
15,
mean,
like, yeah, lifetime. I mean, depending on what your
over the
lifetime is.
implants, yeah,
But
for the implants, if you take care of them. So the key
yeah.
is that once they're in your bone, they're just like regular teeth. If you weren't flossing your regular teeth and brushing your regular teeth, and
Mm,
you're not doing that to the implants, you can absolutely lose an implant. You
I
can lose it just like a tooth. You can
That's
get
crazy.
periodontal infection around it. You can all
Wow.
of that. So don't just think because, oh, I got implants now, like I'm free to just let them go by the wayside. I got to take care of them.
Nah,
You
especially we
absolutely
haven't
do.
got to the cost, but I'm pretty sure this costs a lot. I
You
would be
absolutely
taking care of my
do.
teeth. Especially after you went through all of that, I will not play
Yeah,
around
it's
with
a
that.
lot.
I will
It's
be like,
really a
nah,
lot.
I'm not gonna do that to myself.
But you
Mm-mm.
know what, Erica, is weird because people who are not inclined to have good oral health care, when they have, stuff like this, they're still not inclined. So it's like it doesn't it makes it worse almost because they're like, oh, I don't have teeth now. I really don't gotta do anything. So that's why I mention it. So whenever you have any restorative treatment, fillings, all of those things can fail even more so than natural teeth because they're already compromised. Your tooth is already broken down. So if you have a filling, it's way easier for you to get a filling again on that tooth. I mean, to get a cavity again on a tooth that's been filled.
Hmm.
So don't think, oh, I got a filling, I'm straight. You can easily get a cavity, more so, more so.
Because it's already sensitive to that. Yeah.
It's already broken down. It's already,
Mm-hmm.
so people don't really realize that
Yeah.
dental work is not for lifetime. You really have to maintain it. So
Mm-hmm.
yes, Erica, you're right. If it was you and I, we would change our
Mm.
habits.
Because
And
I'll
guess
be
what?
like,
This is a huge
uh-uh.
investment as well. It's a huge monetary
Yes.
investment.
Yeah.
It's a huge time investment.
And all of that you went through? Oh, heck no. Getting all your teeth removed and stuff? Oh, no. No. All that healing
Absolutely,
and
absolutely not.
no.
Listen, but I see
All
it all
right.
the
I'm sure you do.
time.
All right, so back to risk and benefits.
Yes. So the I'll say so some of the positives are
Mhm.
the fact that these dentures do not slip like traditional dentures. They don't fall out. They're not loose or wobbly. Okay, they are fixed in place. Another really cool thing is that I don't know if you guys know this, but once you have your teeth removed and you wear dentures, um, your bone in your mouth, your jawbone starts to shrink. And so, Erica, if you ever seen somebody without their
Hmm.
dentures in, you know that the face looks sunken in, and you look older. So you look older because the bone you're losing bone. So when you don't have teeth in place, your bone resorbs away.
I mean, yeah, because you see people without their teeth and they're like,
It looks weird.
mm-hmm.
Mhm. Everything's all sunk in,
Yeah.
and that happens, and it's going to continue to happen. But the cool thing is when you have implants, the implants mimic your natural teeth, so the tooth roots, so they stimulate the nerves in your jaw to continue to remodel jawbone over and over again. So it continues to regenerate it so that it's there, you're not losing it, so you're less likely to have that kind of strange look when you take your dentures out, if you get the ones that you take out, because you actually have implants in there that are mimicking the tooth roots and stimulating the jawbone. And they're going to look more like natural teeth
Mm-hmm.
than any of the other options. They're going to, of course, help you restore your oral health, your function, and also aesthetically, your appearance is going to be very well. And they last longer than traditional dentures. So,
What about cons?
so you can have an infection, which is a con for any dental procedure, basically. There can be nerve damage, especially on the lower jaw where there's a nerve that runs in the jawbone, and that's with really any kind of surgery on the jaw, extractions included. And then there can be a sinus perforation on the top arch where your sinuses are. So if the sinus is very low, it's a chance you can perforate the sinus by placing an implant. Very rare because special x-rays and pictures are used to make sure that the implant will not impede upon the sinus. So um, all of those things are very, very rare. Costs. We talked about the cost of implants in the implant episode. They're usually about $3,000 to $5,000 per tooth, cash. If your insurance covers, then you might get coverage. A lot of insurances don't cover implants,
Um,
and your Medicare, you have to check with your insurance if you have it. But they can range. Each office is different, so you just have to contact the office that you're
why wouldn't they pay for something like that though? Like, is that like, is
because
it
there's other
because,
options. There's
say
other
again?
more cost-effective options that insurance company is
Um,
not pay for. So if they can pay for regular traditional dentures, there's no reason for them. They have to pay for an option.
mm-hmm. Okay.
What option they're going to pay for? The one that's more
Okay.
costly. So yeah, they're going to pay for the least amount that they possibly can.
Okay.
So, so yeah, that's all.
All
That's
right.
it. But
Okay.
some insurances do cover, but you got to check your plan.
Okay. And what would be the recovery time?
So it usually takes, like we kind of mentioned a tad bit, 3 to 6 months um, post having the implants placed
Mm.
for recovery before you can start using. In the meantime, you'll have the healing denture over top. And sometimes it can take longer if you have to have that bone grafting that we talked about. So it just depends on what's going on with you. But yeah, about 3 to 6 months.
Can I take care of them? The implant supported dentures.
Okay, so if you have the denture that you can remove, you're going to clean that twice a day. Remember, just like the other dentures, you're going to soak those in like your dental soap, like a Polydent or something like that. So they all have different kinds. And then you're going to brush them with a soft bristle toothbrush. If you have the ones that are supported, that are staying in, so there's fixed and the unfixed, so those you have to really brush like you normally would brush your teeth, but you have to floss underneath the whole thing. So your dentist can show you how to use the floss threader so you can get in there to clean well. And even when you take your other denture out, if you have the option that you can remove, you have to floss and brush the implant areas just like regular teeth. Like I was saying earlier, those can also fail if they are not taken care of. So you really do have to take care of those. Get yourself a water pick, perhaps.
Yeah.
And if you guys have questions, you know, you can always email us at toothbetoldpodcast@gmail.com. So you can
Yes,
ask any questions
ma'am.
there
Ask
as well.
away. She
Yeah.
has the answers for you. Randy
I'll try my
RDH.
best.
That's right. All right, guys. That was so informative. It's lots and tons of information. All right.
Always.
Like she said, check us out. TwoBeToldPodcast.com has all the links to all the socials. Okay. All right, guys. Thanks for tuning in as always. Check us out next time.
All right. Take care.
All right. Bye.